There we go. We are recording. Welcome back to Live with Jane and Jody. It's Tuesday, May 14th, and today we're going to have an exciting conversation with Dr. Arsalan Ahmad today. You guys, I have done some research on this gentleman, and I'm excited to meet him today. So I can't wait to tell you a little bit about him. MD, ND, biotechnology, such really cool information that I've read about him. But first, let's get through the basics. Again, my name is Jane. I am one of the admissions representatives here, helping candidates with last names M through Z. I do need to once more say we are recording this session, and I want to invite you guys, turn on your cameras, unmute yourself. When we get into the conversation with Dr. Ahmad, this is for you guys. We want you to participate and ask questions and really be involved in our conversation. So feel free to turn on your cameras and join us. Again, back to me. I am helping you guys get ready for a successful interview. Let's get you to cross that finish line and join this community and become a future naturopathic doctor through Sonoran as well. Outside of the school, I am still a live entertainment junkie, concerts, sporting events, all that fun stuff. I love it. So as much as I can, that's where I get my thrill. I've actually been out on a few hikes too. We've had a lovely spring, but it's starting to heat up. So we're going to have to call that quits pretty soon too. All right, enough about me. Let me let my partner introduce herself.
Hey, everybody, I am Jody. So I am the other admissions reps. I have the pleasure of working with candidates A through L. So I have actually been with Sonoran. This year will be my 18th year. So I had the pleasure of helping Dr. Ahmad get to Sonoran, or SCNM at the time. So absolutely love what I do. I love the weather. Like Jane said, it is starting to heat up a little bit. So I'm not out as much, but still the mornings are still cool. The evenings are still tolerable. So we take advantage of that as much as possible. So welcome. I'm sure we'll have a great conversation today, and please either interrupt us and, ask your questions, put your questions in the chat. But this is all for you guys, so you can start listening to our alumni and what they have to offer and how they got there. So welcome, everybody. So as you all know, I do share a core value. So core values are beliefs of our institution. So this month, I chose we achieve excellence. So by pursuing greatness, setting the bar high and exceeding it through continuous improvement, enhancing the university experience through innovation and persistence, by celebrating accomplishments, appreciating achievements with humility and gratitude. So that's one of my favorites. So welcome, everybody.
That's good, Jody. Thank you. Good choice. I mean, speaking of excellence, you guys, again, I can't wait to introduce our guest. I've got a few bullet points, but we're going to learn a lot about what this gentleman is up to. So let's start with the basics, his background. So Dr. Arsalan Ahmad is MD, ND. So originally from New Jersey, he's now over in California. Undergraduate from the College of New Jersey in 2012, biology, and then a graduate degree from Georgetown University in 2004 in biotechnology. And then he went on to allopathic medical school, graduate from St. George's University in 2008. And then I love this, just a constant lifelong graduate from, at the time, Southwest College of Naturopathic Medicine, graduated here in 2016, and just continuing to achieve excellence, change the future of healthcare, regenerative medicine. We've got so much to learn today. I'm super excited. Outside of his medical career, his hobbies also include dining out, traveling, sports, religion, history, and of course, spending time with family and friends. So it's wonderful to have you today, Dr. Ahmad. Thank you for joining us.
Thank you. Thank you. Awesome. So I'm just going to dive right in. So I always like to, our first question we always like to ask our alumni is the most popular question. How did you get interested in naturopathic medicine? Where was that passion? Where did it start?
And so, I didn't even know that ND or naturopathic doctors existed until maybe like 2010.
Okay.
And the funniest thing is I was studying for like the USMLEs, and I looked through a Princeton Review catalog, and I was like, oh, there's a school in Arizona. I've always loved Arizona and California because I went there in the 90s. I was a little kid, and I actually wanted to go to school there for like the longest time, but I never had a chance because my parents were like, no to UCLA, no to U of A, no to ASU, anything that was out there. I was like, okay. So finally got a chance to go out there, and then a lot of the regenerative medicine injections like PRP,
Mm-hmm.
obviously prolotherapy I learned after PRP, which is weird, but those always excited me. And in allopathic medicine, conventional medicine, you would have to kind of do that through anesthesiology or
Got it.
through probably maybe some people were starting to do it through physiatry, which is PM&R, physical medicine and rehabilitation as a residency. And
Mm.
it wasn't that like popular besides corticosteroid injections, which was again anesthesia or neurology maybe or some of those fields. So I think I remember there was a MD PhD in Scottsdale. I don't want to give the name just right now, but maybe later, who fascinated me about PRP for some of the athletes for the Super Bowl at the time, which was like, you
Cool.
know, over a decade ago. And I got fascinated by that. And then I was like, what, how else can I learn this? And as well as learn other modalities. Like I'm not going to say regen med is the only thing for people. Like you know, like but botanical medicine, homeopathy, you know, kind of going back to some of my ancestry with family in the Indian subcontinent and the Middle East, they were what were known as in Arabic hakims. Hakim means like a healer. So, you know,
Okay.
that was back, you know, 100 years ago was a very positive connotation given to someone versus, you know, nowadays it's doctor, right? But doctor doesn't really mean what we think it did or does because it's more a teacher, right?
Yep.
Not the physician is really what people are referring to as a doctor, but the hakims, the healers back in the day were the real physicians. So I wanted to kind of
Nice.
tap into that, go back nostalgia to ancestry and kind of do that. But the thing is, it's weird because I do a lot more with my hands than I ever did just like ever before. So whether it's needles, injections, IVs, joints, you know, yeah, that's really kind of, I would
Wow.
say, my story of getting into naturopathic medicine.
Very nice. Very
Yeah.
nice.
Yeah.
You had done
Wow.
all of that education, a complete, like you said, you were studying USMLE and then discovered naturopathic medicine and realized there was really a full package, a complete package. So of course, keep going,
Yeah,
add more
yeah.
tools.
I would say like in terms of allopathic conventional medicine, there it's amazing in teaching didactics and diagnostics and you know, figuring out like I mean, I used to watch House MD growing up too. I don't know if people used to watch that. It was great. It was great for like problem solving, but they didn't really, you know, you don't focus much on therapy. And I feel like in naturopathic medicine, you learn way more therapy and treatments. And whether it's like 8 ways of, you know, 100 ways to skin a cat type situation, you could do, you always come to the end result the same, but there's so many more things and you can give people choices and a plate to choose from what they want to, you know, how they want to be treated, basically,
Mm.
which I like.
Interesting.
So many options. Oh,
Yeah.
cool. So now
Yeah.
you've discovered, okay, there's this great naturopathic option. And you said you loved
Yeah.
California, right? I don't know that the
And
Bachelor's
then
in Rio
Arizona,
existed
Yeah.
yet.
I like Arizona too.
Yeah. Did you apply at all to any of the other schools or just so at the time SCNM?
No, actually, Jody probably remembers. I only applied in Arizona.
Mhm. I don't
But I
think
mean,
that,
there was if they had a choice with San Diego Bachelor, I don't think it existed then. Now I don't
yeah,
think I
that's
would
what I
choose
was gonna
Texas,
say.
but it wasn't a choice. So I didn't want
Yeah.
to be in the other places really, nor Canada. Sorry, no
Right.
offense.
Awesome. Awesome. So when you were looking at the school here in Arizona, was there something that besides location, you said you liked Arizona, was there anything that pulled you to SCNM that resonated with you other than location?
I mean, I think the academics, the longevity of the school at the time was,
Okay.
you know, a big selling point. I know, like, and I always cringe at this, but like Bastyr calls themselves the Harvard or the ND schools. I'm
Yeah.
like, I don't think I agree with that. But anyways,
We don't
there's a lot
either.
more.
The proof is in the NPLEX scores, right?
Exactly.
Yeah, I don't know.
Exactly.
But
Exactly.
acupuncture, some of the homeopathy, like some of
Yeah.
the leading doctors in, back then, the late Dr. Crinian was
Yep.
there,
Yep.
Dr. Messer, like all
Hmm.
the big names, I will say, of
Mhm.
when I researched back then in 2010 were in Arizona. And a lot of them still are there. I mean,
Yep.
maybe one day I'll be one of those great ones, but we'll see.
There you go. There you go.
Actually, I was
Awesome.
going to add that to the list. I was wondering if you were teaching over there at Bachelor San Diego. I was wondering if they had called you in yet.
So, no offense to them, but they never really requested me, although I do kind of teach on the side, especially injection therapies to
Yeah.
the students from the school, but I'm not affiliated or associated with the school in any way.
Wow.
I just know a lot of their students and some of their doctors, but it's definitely I don't have loyalties to them, so
Right.
unfortunately. Yeah.
Okay.
Never will.
Okay.
Right. No, no. But I love it that you are sharing that knowledge, that you are teaching them a benefit that they don't have access to through that program. Like
Yeah.
those areas for sure. You're proving it every day, every way, not just your patients, but with your future colleagues there. That's wonderful.
Yeah.
Awesome.
Yeah.
Did you do a residency when you finished the 4-year program here?
No, I didn't actually do the residency because the residencies that I wanted to do with like injection therapies, I think started after I just finished, especially the pain program in the
Yeah.
Riordan Center.
Mhm.
But I thought about it, but that would have been the one I would have done. And I kind of just did like experience and on-site training with other people, and I kind of I was training with certain doctors like Vance Inoue,
Okay.
Dr. Baratovich and some of the other
Yeah.
ones in Arizona already that, I felt like their training, especially because I focused my last 2 years or a year and a half on the injection therapies was adequate. Yeah, it's sufficient.
Yeah.
So, but yeah, it would have been great if the pain residency or something was available right away sooner. Well, I probably would have done that. Yes.
Gone for it.
Wow.
But by the time you were graduating, you had a specific focus. You knew,
Yes,
man, this is the
absolutely.
tool for me.
I think I
This is
knew
going
in
to be
2013. Yeah.
awesome.
Yeah. Yeah.
Good for you. Good for you. Awesome. So we have a couple questions coming in. Thanks, everybody.
Yeah, I saw that.
Yeah.
Good job.
So good question here. How did the USMLE step 1 and 2 compare to the NPLEX 1 and 2? Very good
Right. So
question.
I quickly typed that in, try to multitask. But so the USMLE step 1 is a timed exam, right? You have about 60 minutes for like 50 some questions with passages, like, sections you got to read a case. I think that is really it's difficult because you have to think fast and quick and come up with a single best answer. There's no wrong answer, first of all. There's no wrong answer. It's a single best answer, right? On the assembly NPLEX.
Interesting.
My strategy, and this is, I would suggest this for even part 2, NPLEX 1 and 2, is don't read the passages because I'd say 90% of the time you can answer these questions without reading the passage. Like in the US Only 1, I wish you could do that. You cannot. That's you have to waste that time to read the passage, unfortunately, in order to answer the question. And NPLEX 1, I think or N2 in particular, you could actually get through many of the questions without reading. And then if you're not sure about something, you want some new information, you can always read back if you have time. There's usually enough time because you don't have like blocks of tests like the USMLE. NPLEX is just like a long, like 3-4 hours at a time,
Yeah.
like
Yeah.
200 questions. It's a very different strategy. Is so different. And me, like I'm not a big I think these standardized exams are not for everyone. I don't think they measure everyone's acumen properly, but you skill wise, you're not really assessing skills here. You're not assessing someone's people skills or like how they relate to people, bedside manner, that kind of thing you would talk about. So it's very different there. And for me personally, I think US MLEs are way harder, but that's just my opinion because I've taken both.
Both. Yeah.
Interesting.
Yeah.
Awesome. Awesome. All right. We're just going to go on with the questions, you guys. I
Sure.
just lost it. Hold on a second. Oh, hold on.
I think it was about the where did I learn injection therapies?
Yes.
Oh, yeah.
Where did you learn IV therapies, injections, etc.? All the skills therapies you use in your day-to-day practice?
Yeah, IV therapies we started learning in, I think, clinic,
Okay.
2014. I will say I've never, and I'm still not like the best like vein person, venipuncture stuff, but yeah, we learned in 2014. But I would say I took the IVNTP course with Dr. Paul Anderson, Dr. Cochran, and Virginia Osborne, Brendan Cochran, Virginia Osborne in California in 2017 to get the official, because in California you need that now. Back then it wasn't a requirement, but it was good to have, and I did it. So I do advise people to get that IVNTP certification if you're interested in practicing in California. In Arizona, I think it's sufficient with the school and the teaching. I would say rotate with the I mean, I'm not sure who's running the IV shifts currently right now. But I would try, join in those. Like I joined more of like the injection there, like acupuncture and some of those shifts, but you can actually kind of, pick and choose what shifts you may want to do in order to become more proficient in one thing or the other. And IVs, I think I learned then. The injections, there was numerous courses that were offered between 2014 to 16. So I tried to take as many that I could afford at the time. So there was some on campus, some were outside of campus. I don't know if Dr. Jason Porter is still around, but there was a lot of doctors that would be willing to teach students who had that interest in that. And I feel like here in San Diego, I do kind of, I try to let those students too here take advantage of that.
Nice.
Same thing. Yeah.
Very nice. Very
Very
nice.
different, because like you're saying, all of those experiences, you had to do them in your extra time or through the clubs or through external resources, where now we have that Neil Riordan Center.
Exactly.
It's
Yeah.
already
Right,
a lot
right.
more accessible to the students.
Yeah.
Right.
I think my last year I
Really
had Dr.
evolved.
Cleve Bethel started
Yeah.
the anesthesiology. Yeah. So I tried to jump in whenever I could and watch stuff
Yeah.
on fluoroscopy guidance. I don't really do fluoroscopy right now, but I work with someone who has it, so it's kind of nice. But now I'm sure they're teaching ultrasound guidance and stuff. So back then we kind of learned what is called blind, but it's not really blind if you know what you're doing, if you palpation and you learn your anatomy well with the other doctors. So yeah.
Wow. Wow. So much has changed, and it's so fun to hear
I'm sure.
the names of the doctors that are no longer at Sonoran because they've retired, and Dr. Brodovich, Dr. Cleve Bethel is still there. But so
I
it's fun.
saw him recently. Yeah.
Did you? Yeah.
Awesome.
And
people do Naturopaths Without Borders. Like he still comes. So
yes.
You're doing the Hustlers too. You do NWB still currently.
Yeah.
Wow.
I did it in
Awesome.
September. I'm gonna try to go sometime in the next few months. A lot of times they go on like the Memorial Day weekend, for example. So it's sometimes not other plans, but it's always a thrill and a joy to go to these events. It's great to kind of see the students, the younger crowd, and it's a fun time in Mexico. I mean, it's a lot more humid there than Arizona, but it's still pretty nice. Yeah.
You do get a little bit of downtime, a little bit of a break. That's fun.
Yeah.
Awesome.
Right.
Awesome. All righty. Let's see. Next question. Can you describe what exactly regenerative medicine encompasses?
Yeah. So we already know allopathic, conventional medicine, homeopathic medicine, osteopathic, naturopathic. I think regenerative medicine is the next wave that we will see coming forward. What does it mean? Is basically using I mean, the simplest and most applicable way I would say is using some sort of like stem cell based products, whether it's exosomes, Wharton's jelly, your own body's tissue. It could be from outside sources. It could be your own bone marrow, adipose. It could be placental umbilical cord tissue. Because of my experience working overseas and internationally as well, there's a lot of things going around in the world, like Thailand, Germany, Colombia, Mexico, Costa Rica, the Middle East, Switzerland. They're very advanced in some of the therapies they offer. So regenerative medicine is kind of using, even homeopathy technically is included in here, because you're using your body's own ability to heal, whether you use your own cells, someone else's cells, you stimulate stuff using botanical herbs. It's just basically finding a way for the body to regenerate and heal itself without having to use surgery or medications. Yes, it does involve a lot of times injections, even IVs, even like peptides, say in subcutaneous. So this is all included, in my opinion, and it's a real wave. And when I write my business card, I write regenerative naturopathic medicine specialist.
Awesome.
Oh,
So, yeah.
okay. Awesome.
That
That's
was
great.
so well said. Like it just so
Yeah.
thorough,
Yeah,
and
I
it
think
really
it's a
like I
new
get
wave.
it. I get
Yeah.
it. Yeah, especially because you help us see around the world, like everybody else is doing this already. It's time for us to catch up,
Yeah,
really.
and you know, a lot of people may have like computers or engineering background, so they're aware of like nanotechnology. Nanotechnology is like those little microchip little computers that you can actually they could potentially use this here. AI is also part of this, right? Artificial intelligence. This is all incorporating now into medicine. You know, I feel like I still have another 20-25 years before AI or robots replace me and the skills I do, but you know, this is the new wave with at least like if you include like biotech, you know, like using some sort of healthy smart drugs. This is all included, I think, in my opinion, of regenerative medicine. So
Wow.
Is that
My
those
head just
this
went boom.
yeah, right. I'm thinking of the diabetes, like I see the white
Yeah.
the packs or whatever. Is that when you talk about like smart drug? Is that something that you're referring to? Something along those lines?
oh no, I'm talking about like they'll like put like immunoglobulins and stuff markers that'll go in and target either to activate natural killer T cells, or they'll go in and just kill cancer cells. Nothing else. They won't harm anything else except that cell. So they're like smart drugs in the fact, or smart treatments. I'm not gonna say drugs. They're not actually drugs. They're like therapies, biologics included, that just go in and focus on you know, for me studying in military history, it's like you know, like a pinpoint targeted attack, like through tactical, like, you know,
Yeah.
drones, and they just go and they'll mark a target with lasers or whatever, and then the bombs and missiles will go in and just destroy that instead of doing collateral damage and killing, you know, innocent bystanders and civilians instead.
Right.
If you think like a military strategist, that's the best way to describe what we're talking about here.
Wow.
Very precise. Oh,
Yeah.
amazing.
Absolutely. All right. Our next question is a two-part. So, what advice
Yeah.
would you give to an incoming student is the first part. And what are a set of things you would change throughout your medical journey? Good question.
So we'll go to the first question. Yeah, as an incoming student, you are shaped by your experiences and past education. So you may have to adjust whether you came from a science background, math background, economics, whatever, right? So you just got to kind of adjust your mindset a little bit, philosophy, but at the same time, you still want to retain your principles and beliefs and, you know, whatever got you to that point. So do that, you know, learn from the professors and stuff, how they're teaching and giving you advice to tackle, like, you know, exams or something, and adjust your study protocols and etiquette there. But you also want to work with people. You know, I would say a lot of doctors are just kind of you know, they're just out for themselves, and they don't want to be on a team. They want to just, like, you know, do things on their own. So you got to, like, you know, find people you mesh with and work with, whether there's the same interest, or, you know, you can study well, you learn something from them. You teach them stuff, they'll teach you stuff. So you have to find a good group and team to, like, work with. That's what I would say for an incoming students. And then what would I do differently myself? You know, I think if I had, you know, had the circumstance of knowing about ND medicine earlier, I probably would have veered this way instead. But at the same time, I don't regret my conventional medicine background, because it still helps me with procedures, and, you know, like sometimes you're accessing ports for cancer patients or PICC lines and things. So I do value that experience of being in the hospital for a bit. I would never want to work in the hospital long term, me personally, because I don't think hospitals are there to actually cure people. They're there to treat people, great, but they're not actually fixing and curing people. And another thing, caveat on that, basically, is regenerative medicine. I will say this: it is the best way to fix, cure, treat, and, you know, anything and everything you can think of on Earth, except for one, which is death. So that is where I would say, you know, like your spirituality, your energetics and stuff comes in, and whatever you believe in terms of like afterlife is critical there too, because a lot of the healing also starts with you know, internal. Like we are limited by our, vision, smell, sight, taste, these four or five senses, but there's more beyond that. There's things we can't detect. There's organisms that are there that we can't test for. So you have to kind of tap into all the different therapies modalities that you can find, including things like ozone that can help against those invisible pathogens, energy healing, just like positivity. I feel like if you are a good, human being and you have like emanate positive vibes, you can help heal someone just by that. Even if you don't know exactly what you're doing, but if you have that positive outlook, I think you can help heal people.
Very good.
And learning that took a long time.
Being open to what is
Yeah,
possible to
exactly.
heal. Yeah.
Yeah.
Right.
You.
So this kind of goes into the next question. I mean, so perfect timing. So how did the basic didactic science courses compare between the MD and the ND programs? And do you feel one was more complete or more in depth than the other?
That's a good question.
Yeah.
I actually did not take all the basic sciences in Arizona. So as a result, that was not as easy for me to answer. But I would say in terms of diagnostics and some of those things, the didactics in both fields are adequate, and if not more than adequate. So, I do think that ND medicine, they do a lot more focus on some of the basics, like microbiology and some of those areas. However, in MD allopathic, I would say pathology is the best. Pathology is way better in conventional medicine. So like diagnostics again, and like kind of figuring out, because you're analyzing tissue really well, like histology and that kind of thing. So there's definitely benefits and advantage, disadvantage in each. So
you still had to take NPLEX part 1, even though you didn't have to do the sciences here all over.
Yep. Excuse me one second. It'll be half an hour. Sorry. Yeah, sorry. Yeah.
I know. He's a busy guy.
We are so grateful for your time. Thank you, doctor.
No worries. Sorry. I think I lost my chain of thought there.
That's okay. So I have the next question. It's kind of lengthy, so I can read it or we can go one at a time. A rare ND and MD background. Could you compare and contrast ND and MD? 1, the training and education. 2, opportunities, professional growth, personal growth, and healing. 3, benefits to, I'm not getting some of it, benefits to patients. 4, other, what can naturopaths offer that allopaths cannot or less likely to offer? Benefits of NDs and MDs working together. That's a lot of questions. Thanks, James.
Right. I'll try to go quickly and then we can cover more bases if there's something more specific. But compare and contrast, definitely, like I said earlier, MD is a lot better with diagnostics and problem solving. But ND, I would say, is better with therapies, modalities, and stuff. You have a lot more to choose from besides drugs and surgery, pharmaceuticals and surgery. Are they improving in the MD conventional? Absolutely. I see this in the West Coast, like California, immensely. They have a PA program in Southern California, SCU, not USC, but SCU. So if you know US University of Southern California, it's different. It's SCU. They have a PA program, and they do they have rotations in integrative medicine, they call it, right? But it's basically a combo of functional medicine and naturopathic medicine, right? So they're doing that. There's some of the other medical schools are trying to tap into that. Even I read in St. George's University, where I went for my allopathic, they are starting like some sort of a natural program there in the Caribbean, the islands. Obviously, they're not base soil per se, but they have that going. So that's, I think, great. I remember when I was in allopathic school, we took like 1 or 2 weeks of nutrition. We took maybe a elective, if you had time, 1 week of what they call complementary medicine. It's like you learn, different osteopathy type stuff, manipulation, phys med. not even acupuncture at the time, but I'm sure they're trying to incorporate that in. So I think the ND opens up the world of opportunities there. And then if I tap into like some of my religious and ethnic background, there's a Arabic therapy called hijama, which is basically a combination of cupping and incisions, like little cuts in the back, for example, and you drain. It's almost like bloodletting, but it's not blood. You're draining out like toxins and poisons that are in the body using cupping and fire cupping. So it combines a lot of stuff. So that I learned that in the Middle East. So it's like you don't learn
Wow.
all this in school. You don't necessarily the Ayurvedic medicine, another one. Ayurvedic medicine, another a great field that we just don't teach enough anywhere. And luckily I went to school with Dr. Vasant Lad's son, Pranav, and he was in the same program when I was at SCNM, now SUHS, obviously, but and then I know Dr. Sodhi from Ayush Herbs. They're invaluable in terms of, like some of the therapies. And if I don't know something and I don't know Ayurvedic medicine that well, I usually ask these people. And then I worked in the Maldives for about a year and a half. There's Ayurvedic doctors there from Kerala in South India. So, these experiences are, you're not necessarily gonna get in school, but if you can find it, like if there's someone offering it, take advantage of that. Some people will come like seasonally or temporarily. It can be rare, but it's great, and you want to learn as much as you can from different specialties and areas, even if you don't know them or if you don't understand them. I think it's good to just kind of get exposed and immersed a little bit in some of those fields. Let's go to question number 2, opportunities. Unfortunately, like recently, I feel like there's less opportunities than there used to be. But ND Job Link, which is I forget who runs it now. Back when it was Joanna Hagen, I know she retired probably, but those opportunities listed from SCNM or now ACUHS are also wonderful. Like that's how I found the Maldives job, right? I mean, that was like great. There was positions I know in Dubai, in the Middle East, all over the world, all over this country, Canada as well. Those are great for getting opportunities. But recently, and even like Indeed now, you can find specific naturopathic doctor opportunities. And the great thing is there's only a certain amount of people qualified for some of that. So you have a leg up if you have that ND background there. Benefits to patients. So I feel like the patients, especially now since with COVID and the pandemic over, they are, unfortunately, they're losing a lot of confidence in the conventional medical system, in my opinion. Even I am. I don't have the confidence that I used to, and I don't necessarily trust everything that was told to us. But that's a different story. I'm not going to get into that. So I think in terms of that, I think a lot more people are open to naturopaths, more open to maybe even someone like me, because I have a dual doctorate, so I get jokingly called Dr. Squared sometimes. So and I have two A's in both my first and last name, so Dr. A Squared. That's usually my nickname. But so that's great for like, because you have a lot more I think headway with patients because they trust you more. And I think they do trust a lot more naturopaths than sometimes regular doctors, unless they're like those doctors are kind of open to everything. But that's what I would say in terms of benefits for patients. And then what can we offer as naturopathic doctors versus allopaths? Again, it's all these therapies, IV nutrition, peptides, injections, even the joint injections in particular. You don't really get that kind of training in conventional medical school. So if so, an orthopedic surgeon or someone is trained in that, but they probably learned it on the weekends or on the side, because I'm sure they didn't have that time to do it otherwise. So there's a lot more training and stuff. If you seek those trainings and do it, then you will definitely be ahead of the curve with a lot of other doctors. And even if they do, other people do it, sometimes we just do it better. So
I agree. So Maria had mentioned too, which I do know this, University of Arizona is implementing an integrative medicine center as well.
They have the wild
residencies, right? Exactly. Yeah. So absolutely. All right, so let's go on to Ethan's question. What would you recommend doing to bridge the gap between diagnostic proficiency between the two medical trainings? Or would you simply just refer your patients out to allopaths for certain diagnostic modalities?
No, I don't think the deficiency in diagnostics is not per se because of the schooling. It's because of experience, exposure to those patients. So for me, like I've worked in the Caribbean, I've gone overseas, I have seen rheumatic fever. I've seen some things that just you won't see that necessarily in the US. Even in the hospitals, even if you were to go shadow in the hospital, you may not see a lot of these cases. So I think it's just a matter of getting more experience, being out there. That's why, again, I reiterate back like Naturopaths Without Borders, like in Mexico, Thailand, they used to go to Haiti, and wherever in the world they go, you will see so much more pathology that you won't see in North America, for example. You just have to kind of get out there and experience it, whether you know volunteer or you do on your own time. That is where I think you will get the gaps between diagnostics better fixed, because you just need exposure, you need experience. You have, you know, there's no schooling you can do for a few weeks or months that compares to like 8 years of experience out in the field, right?
Yeah.
That's just you the internship or externship, whatever you need to do to get that like experience, you should do it. If you could do it early on, like high school or undergrad, wherever, great, but not everyone has that opportunity. So you just have to kind of seek it out, basically, I would say there. And referring, I definitely still refer to a lot of doctors, you know, like some of the injections, if they're done under fluoroscopy, like in the back, I'd rather someone go to that specialist. Like I have a cardiac anesthesiologist that does that. I'd rather them do that, like especially some back injections, for example. So, and then, you know, like, you know, some of the foot stuff, eyes, whatever, you want to have a network of people you can refer, people that you trust, refer these patients to, so that they will do things as you want them done.
Very good.
And then, yeah.
Let's see, what's next? I lost my spot.
Would you say?
I think it's the ND
ND
medicine,
medicine
is
is
suited
well,
for private
yep.
practice.
Yep.
Yes, thank you.
From looks like Yahya Haider.
Uh-huh.
Hopefully I pronounced that.
You
'Cause I
got
know
it.
Arabic a little bit, so
Did.
Yeah, you got it right.
shukran Habi. But
Yeah.
yeah, so that I would say yes, it's well suited for private practice. I would say even like ambulatory. If you are looking for ambulatory medicine, I mean, like if you're looking for you know, lifestyle medication medicine, which isn't things like OB-GYN, is not surgery, trauma, emergency medicine, right? Then yes, this is well suited for that. Regenerative medicine, same thing, because you know, you're not gonna have to usually do an emergency back injection unless it's like someone just got in a car accident, right? So a lot of the therapies and the consultations are not emergent. You can still work in an urgent center, but you're not really doing like big emergencies, like where someone has a major car accident or a ruptured spleen or something. You have to go straight to OR, right? You're unless you're an orthopedic surgeon, you have like open fractures, you take them straight to the OR. So you don't have to worry about that in our field, which, you know, may or may not be, everyone's different. Some people like that thrill, like that they probably grew up watching that show ER or whatever. But you know, they maybe they want, or Grey's Anatomy, like maybe they want to do that. But I think ND medicine is more private practice and clinical outside the hospital. So which for me I like. Like I said, I don't think people always go to the hospital for cures. They unfortunately will eventually die there. That's just the reality. I'm sorry.
It's true.
What was the next question?
Let's see.
What got me interested in therapies? So I assume that means the therapies I do. I've always liked working with my hands. I always liked you know, so if you learn injections, for example, they'll say palpation gets you so far, but the needle is your palpation, like finger going in deeper into the tissue where you can't actually put your fingers, so you can actually feel ligaments, tendons, bones, structures, you name it, joints, whatever you can put your needle down, you can feel it, and you can actually get to the point without ultrasound, without X-ray, where you can tell the difference between it may make a sound and like a cracking sound, a crepitus sound, but you'll know where you are in the body. Obviously, if you got blood, then you know you're in a vessel. That's a venipuncture thing, right? But if you these therapies are interesting because that's why I like needles. People think I'm like demented because I like needles, but it's a great way to do therapies, avoid surgery, right? Avoid yeah, I mean, even though we don't want to cause pain, but for me, sometimes no pain, no gain with like some of the therapies I do because I need to reproduce that pain in order to properly treat it. So if I'm not doing that, I'm probably not hitting the right spots with my needle or injection, for example.
Oh, it didn't hurt bad enough. Hang on, I missed something.
Yeah, exactly. That's what I was thinking, Jane. All right. Yahia asks another question. What would you
Sure.
advise incoming ND students so they can make the most of their time in school?
Yeah, I would advise to figure out what you are really interested in. And sometimes you may not know first year. Maybe it takes second year, third year. And then latch on to the people who do the things you like. And even things that you don't like or you never know, or you're unknown. Like find out what they do and learn about it because maybe you find out you like it. Something that there's always saying, this is a religious saying, like sometimes things that are not good for you or don't taste as good, they're actually the best for you. That's just, a very old saying. Like if sometimes if you don't like to eat, something doesn't taste good, right? But it's still really good for you. So you just, find a way to adapt and learn how to, take it in, grin and bear it, whatever you want to do. And whether it's like a therapy, if it's a philosophy, a school of thought, modality, just learn it at least. Maybe you'll grow to like it. Sometimes it's not love at first sight here, right? So you just eventually you grow into it.
Interesting. All right, let's see. Have you seen a provider who specializes in OBGYN and is a naturopathic doctor? If so, what is their practice like?
I have not seen very many. There's a few. A lot of them, I feel like they focus on, live births or underwater births. I do know someone like where I work nearby in La Jolla or near La Jolla that does like PRP injections into the ovaries to help stimulate fertility.
Wow.
Combined with other
okay.
That's really fascinating. I learned about that 3 years ago and I was like, wow, that's great. So I would say fertility wise, I know more people than people who are doing like more actual OB stuff. Gyne, there's a lot of doctors doing gynecology specifically, but OB part, obstetrics, I would say not as many that I know unless they're actually MDs. So.
Wow. All right. How did you mentally prepare for medical school?
I would say, you kind of have to just get into a mindset where you want to lock down, try to avoid distractions and just focus on what you're trying to achieve, the end goal. The end goal, like, I mean, it might be a little different in ND school, but like the first day you start allopathic school, right? You get the white coat ceremony. So you are technically called a doctor from day one. I know in ND, I think it's like third year or once you get into clinic, which I think maybe we should consider changing. I think if you have that like thought in your brain that you're a doctor already, then I think you're motivated and more driven to succeed and get through whatever you need to do, whether it requires you staying up more late to study, don't advise that all the time, but whatever you need to do to achieve your goals and maybe avoiding going out to party or drink or something one weekend, you have to just figure out your end goal and just kind of get into the mindset that this is a few years. I got to just focus and try not to mess up my health, mess up my future. Those are the kind of things, sacrifices you have to make in order to achieve your goal. So that is the mindset I would advise people. Just if you know what you want, you just do what you have to do to get it.
Be focused. Yeah, it's just driven. Hit that target.
And I see there's another question about midwifery. I think there's more naturopaths doing midwifery than they are like actual true OB. Because I mean, we're not doing C-sections, right? So
Right.
whatever, and you don't need to do C-section. There's so many ways, even Ayurveda, or like they can put like ginger on like one of the points, and it helps to, flip the baby for if it's a breech position. So there's a lot of things you could do to avoid C-sections when you want. And I would say this is just a clinical pearl that I'm right now, we're doing a lot of stuff, or I'm learning a lot about fecal transplants. So you can help avoid so much for future with kids by breastfeeding them if you can 2 years old, until 2 years old,
Wow.
and by letting them have a true vaginal birth, because they get the bacteria from that birth canal. And they're finding a lot of people that had deficient microbiomes right now are the ones who were C-sections, or just not, they didn't have the normal delivery, like without epidurals, without whatever. I mean, I'm not a woman, right? I can't speak for women, but like I feel like a lot of the the old school thought processes. And I come from a culture where they have wet nurses. Like when women weren't able to breastfeed their kids, they had people in the tribe, for example, like a tribal tradition where other women who were like maybe secreting more prolactin and lactating more, they were breastfeeding the kids. So much so that we were taught you can't even marry like the children between themselves who are breastfed from the same mother, because and then you learn that now because the immune system and some of the genetics is overlapping. So there's a lot of like ancient wisdom, I would say, that is starting to come back. And I even relate with like music. Like there's a lot of like retro music going now. It sounds like the 1980s when I was born and raised. So this is like a lot of like things are going back to traditional stuff that maybe that's the right way. Maybe we need to think back, look at our history, and figure out what's the best way of giving birth, breastfeeding, everything.
Yeah, absolutely. Absolutely. All
Yeah.
right, let's see. So where do you see the future of naturopathic medicine going? And do you see NDs gaining more privileges in the future? Good question.
Yeah, this I think ties down with the regenerative medicine. I think that is the future. I went to a stem cell surgical network conference last year in June. I think they focused on how this is the future. Like they're not so much focused on just using drugs, medications, prescriptions, surgery. They're trying to figure out a way to heal people, make them live longer, anti-aging, longevity. So that I think is the future. Preventive medicine. Obviously, this is all preventive, right? Genetic testing to figure out what, they can kind of like predict problems that may arise in the future way before they actually happen. So, screening, again, this is where the diagnostics, where we can't neglect allopathic conventional medicine, because their diagnostics, especially with genetics right now, is phenomenal. And we have the tools to help them, complement them, and we should take advantage of that. In terms of privileges, yes, I do think NDs will have more privileges. Do I feel more confident in some doctors in some ways? Yeah, I do, in some things, like procedures especially. A lot of doctors, they're scared to do things. So, like something as simple as a venipuncture, there's a lot of doctors are not very good at it. We are probably better than a lot of them. And I get sometimes it's like age and experience, exposure, but they also don't get taught very well venipuncture in allopathic conventional school. Like unless they're a nurse. I used to be a nurse or something in the back in the day. Even the PAs, they don't get taught like the skills that some of us get taught or seek to learn. So I think privileges wise, definitely. And prescriptions, I don't really use a lot of prescriptions, but antibiotics is probably the most common, or antifungals. But yeah, I definitely think there will be more I think independence in terms of doing medical allopathic conventional medicine activities that we don't currently have right this moment. In Arizona, they have almost the widest scope possible right now for ND.
Right,
So,
right,
well, I mean, one of the reasons what people ask me why I didn't stay in Arizona is like I just didn't want to compete with my colleagues, and honestly, I do come into Arizona like once every 2-3 months, anyways, whether it's for conference, visit friends, or sometimes we have to like exchange ideas of like therapy. So it's better to do in person versus over the phone or Zoom. So I do come to Arizona a lot, but it is a little nicer weather in San Diego than Arizona most
Just
of
a
the year.
little, just a little.
Tell us about a day in the life of your practice. Like, are you seeing
Yeah, that's what I was
patients
gonna
from
say.
pediatrics all the way through to geriatrics? Tell us
Oh,
about your practice. How many doctors
great
are in your
question.
practice? Yeah.
So right now, this is the first time I probably worked in a fully integrative practice. So we have a chiropractor, an acupuncture, TCM doctor, we have massage therapists, we have two cardiologists, which I'll specifically say that, but
Wow.
they do integrative medicine. And then we have a former ER doctor who's now doing functional medicine. And we just started with a nurse practitioner. I'm here. I'm kind of like I fill in the gaps of everything else that nobody else does. Whether it's like helping with cancer patients, with injuries, pain management, sports medicine, all the IVs I supervise really. So I'd say every day
Wow.
I'd probably be doing like 70% currently, mostly IVs, including the consultations for IV nutrition. There's a lot of patients here, or I'd say more geriatric and older, above age 50. Once in a while we'll get some younger than that, but it's usually the baby boomers, I guess you could say at this point, or even more. We have a couple patients that are in their hundreds. We have many in the
Wow.
90s, 80s. We don't really see very many kids, but we have a few, mainly like patients' kids or grandchildren. However, I would say we don't do much pediatrics. Having two nieces, my sister at least, not my own kids yet, but I mean, they're scared of anyone with needles, so I don't want to be that bad guy for them with a white
Yeah,
coat.
yeah.
I don't wear a white coat typically because I also don't want that stigma of like coming with needles and stuff. But yeah, I mean, I would
Yep.
say consultations. I do like the fact that I'm not sitting behind the desk like the whole day and talking with people in front of me or through Zoom, telemedicine, but I do a little bit of everything. So that's kind of nice. Even telephone, like old school, like just telephone calls sometimes. But yeah, I don't think for me personally, I would love to just be in one position constantly. I don't mind what we have like a 3-story clinic. So I literally sometimes will run up and down stairs when it's really busy, like every 15, 20 minutes. So but it keeps me
Wow.
shape, especially
Yep.
because I don't get to work out like I used to play basketball or any of the sports I used to play. So
Busy though.
Wow.
How
That's
exciting.
awesome.
That's a lot
Yeah.
of
yeah,
docs. Like, what a great combination. Oh,
yeah,
how
it's a very
fun.
integrative center. Yeah. And it's
Hmm.
very close to the beach, so you can see the beach from here in La Jolla, which is a really nice area of San
Yeah.
Diego.
Very
So
Beautiful.
nice.
everyone's welcome to come and check it out here if they want.
Hmm.
We're trying to get like official rotations for students at least through the school here or even through Arizona. I don't have a problem, but it's not easy, I know. So it
Right.
takes a lot of admin stuff to get that place called. Someone just asked what the place called. It's called Pacific Pearl La Jolla. So PPLJ. If you go to pacificpearllajolla.com, you can see the website. Currently where I am. But I also do some stuff elsewhere too, which is in Del Mar and Laguna Beach. So definitely like the beaches. It's very beautiful.
Yeah.
Get good. A lot of patients will try to come out there, and they also come from far away. We get patients from China, from Middle East, Europe, Russia, wherever. Well,
Wow.
Russia maybe not so much right now, but we used to.
Wow. Looks beautiful. How
Neat.
nice. How nice. So I'm assuming, real quick, I'm assuming that you went into practice right after you graduated Sonora
Basically,
or
yeah.
at C&M.
Yeah.
Do you feel that you were ready to go? You were prepared, the schools, whether it was your MD program or your ND, mostly your ND, do you feel like I'm ready to go? I can treat patients and I feel like I know what I'm doing.
Yeah, that's a great question. I would say me personally, yes, but because I had the allopathic training and I've exposed a lot of
Okay.
patients, but I do feel like a lot of the other students are a little intimidated and they might not be able at that point. I'm definitely, I was a lot older than many of the students were at that time in my 30s. So it's different, but I mean, I think that's a level of confidence. If you feel like you've seen enough in school, you may feel confident, but I would definitely for someone mid to late 20s, I would advise try to do a residency,
Okay.
train under
Okay.
people, even if it's for like a year or less than a year, it's still useful.
Okay.
Yeah, I mean, we don't take residents here, but I'm saying other places that do, even the school, you know, SUHS.
Mhm.
I was about to say SCNM, but SUHS and all that, they have great programs. Even some of actually you know, you mentioned University of Arizona. I think they have programs I feel like NDs can apply to. I know in UCI, University California Irvine, they have a program, at least a residency. You can get into some of these programs. I think it's a good idea, especially if you're interested in working, collaborating with conventional doctors, DOs, MDs, chiropractors, whatever. Try to get into
Nice.
one of these integrative medicine residencies. I do think they're going to become more. There'll be a plethora in the future, I feel like, but it's not right now, but eventually in the next 5 to 10 years, I think integrative medicine will be big, and they're going to want NDs working with, especially if you do cancer. I know Cancer Treatment Centers of America, a lot of the cancer places, they want NDs on board,
Yeah.
preferably in a licensed state too. So
Right. I know we had a couple NDs on board at the Cancer Treatment Centers of America in Phoenix. So yeah. So does your office ever let students shadow? Like come in and observe what
Or
you do and, you know,
I mean, I know they have a program set up with the PA program that I mentioned, the SCU, and then they have some University North California Medical School as well. Again, this is probably a knock on Bastyr San Diego, but something fell through a few years ago before I came here with the school there. So they used to have residencies and rotations here with
Oh,
them.
goodness.
I
Hopefully,
gotcha.
you know, I pray I can rekindle some sort of a thing. And I'd rather be with, you know, obviously SUHS, but you know, that's just like alma mater. But you know, I do think it'll be great for them to come here.
Right.
I'm still working on it. I'll keep us up to date. I would
Keep
love to
working,
have
keep
students.
working.
I do let sometimes students just come and just like for half a day or a day, ND students, and the doctors are open to it. It's not like they're not.
Okay.
It's just I think it's the admin bureaucracy stuff gets in the way, especially with at least San Diego Bastyr.
Wow.
Unfortunately, it's too bad.
It's unfortunate. Yep.
Yeah.
Yep. All right. Last 2 minutes. What word of advice would you give to these students that's getting ready to embark on this amazing journey?
I would say, you know, be yourself. Whatever got you to this point is a reason you were accepted to the school. You have Jane and Jody here. They must have seen something so you know, nurture whatever brought you in, whether it's like art, whether it's history, science, computers, whatever, you know, apply what you know and use it to your advantage at the school and through your training. And then, you know, just find people who you kind of vibe with and you have good energy with, and get to know them. You know, thankfully we had a great cohort back when I was in SCNM. So you know, find people you do well, and it doesn't have to be in your specific class. It could be like a year or two behind you, 2 or 3 years behind you or ahead of you. The residents, it could be the residents that they're there. They're probably not much older than you are or like around your age. So you find people you relate
Right.
with and jive
Right.
with them, and I think you make connections, make networks, and you know, I'm more than welcome. I'm more than happy to be you know, a mentor, I guess, at this point in my life, to students now. You're welcome to contact me. I'm pretty you know, inviting. Hopefully I'm not a mean. I like needles, but I'm not like mean to people.
Not at
I
all.
wasn't
Probably someone with a
intimidated
needle
at
in the first
all. No, no.
time.
Awesome.
Very refreshing. What a wonderful conversation. One more time, the name of the practice again is Pacific Pearl.
Yeah, I
Oh,
just put my
fantastic.
email address there.
There you go.
Very
So
good.
if you just
Perfect.
go on that as a website, you'll find it. But
Oh my
Very
goodness.
good. Very
yeah.
good.
So much fun.
Thank you
And
so
then
very
if
much.
you email me, I email pretty quick. So and
Yeah.
then if need be, we can share phone numbers. But
Awesome.
I check my
Awesome.
email pretty regularly. So
Good, good, good.
Fantastic. Dr.
Good,
Ahmad,
good.
such a pleasure today. Thank you
Yes.
so much for
So
your
good
hour.
to see you.
I know they're knocking on your door
likewise.
over there. Thank you to all of our candidates for these
I
awesome
know.
Yeah, it's beautiful.
questions and
You can
joining
go
us
straight
today.
if people like to surf, they can come surfing here because Wind and Sea Beach is famous.
Oh, there you go. There you go. Awesome.
Very good. All right, I am going to go ahead and stop the recording. Thank you all for joining us today.